Thank you, Natesh, for that warm and kind words. India is the diabetes capital of the world, closely losing to China. Every diabetic male has some or the other bedroom woes. 82% of men who have diabetes are struggling in silence. 40% of men across the globe have these issues. So in this next 15 minutes, which is too little, I'm trying to cover up everything what you should know about diabetes. Of course, with pranams to God and thanks to my teachers, I have no conflict of interest. This talk is about sexual dysfunction and may contain some naughty images. When you are married, wonders happen. And when you get diabetes, you wonder what happened. If you think about diabetes and sexuality, two things are very important for all of us to know. That erectile dysfunction in diabetics occurs as one of the first problems, and there is definitely less of testosterone in them. And so every diabetologist or every primary care physician or everyone gathered here should not only focus on the glycemic control of the patient but also address their sexual complaints, because these problems are significantly impairing their quality of life. In diabetes, there is a threefold increase in the risk of erectile dysfunction, which is documented against non-diabetic men. 80% of men struggle in silence. When I googled, I found Viagra had 196 million web pages and aspirin had only 53 million web pages. In diabetes, it is not just erectile dysfunction. Of course, we now know it's endothelial dysfunction. There is definitely emotional dysfunction. Early diagnosis can prevent early death, and education is the key. So it's a huge problem for a diabetic plus his partner, and there is definitely a dent in the relationship. It's highly prevalent in India and China. So I call erectile dysfunction, though it's one of the commonest complications of diabetes in men. So I call Chindia the erectile dysfunction capital of the world. A lot of causes of this, we all know about it. But my teacher beautifully says, nerves stimulate, vessels circulate, muscles facilitate, and hormones regulate. Our first data when we worked together for 10 years in KEM, 56,000 patients, all were diabetics. Most of the men had erectile dysfunction, early ejaculation, low desire, and women had low desire and depression was the most common thing which we saw in all women diabetics. So now let me give you a newer perspective of this. I've explained to you all this, but when there is hyperglycemia, there are increased advanced glycated end products and oxidative stress, ultimately leading to molecular alteration, and there is cavernosal endotheliitis, leading to functional alterations in the corpora cavernosa, leading to erectile dysfunction. So, erectile and endothelial dysfunction in type 2 diabetes, there is definitely a link. And everything depends upon what happens in the endothelium. So, you are only as old as your endothelium. What we see in diabetics, there is decreased nitric oxide bioavailability. Capillary basement membrane thickens with prolonged hyperglycemia, and this is a structural hallmark of a diabetic microvascular disease. If you look at the diabetic corpora cavernosa, because of glucose overload, increased advanced glycated end products and increased ROS, there is definitely endothelial cell dysfunction which results in decreased nitric oxide, increased apoptosis. Simultaneously, we also see decrease in the testosterone, and there is definitely corpora cavernosa smooth muscle cell dysfunction. Let me give you a deeper perspective. Many pathological mechanisms have been understood in diabetes. Amongst them, the most prominent are elevated advanced glycated end products, increased level of oxygen-free radicals, impaired nitric oxide synthesis, increased endothelium B receptor binding sites, upregulation of Rho kinase pathway, neuropathic damage, and impaired cyclic GMP dependent protein kinase 1. If you look at the molecular basis of diabetes associated, there is definitely a turning off of Rho kinase, which produces generalized vasoconstriction. Another hypothesis that apoptosis play a critical role in diabetes associated ED, and assessment of rat diabetic penis revealed there is decreased expression of anti-apoptosis gene BCL2. In COVID, we saw there was a bidirectional relationship between diabetes and erectile dysfunction because SARS receptor angiotensin converting enzyme type 2 was expressed in human pancreatic islet beta cells and upregulated during inflammatory stress, which was in COVID. And they also found this COVID-19 endothelial cells viruses present in the corpora cavernosa. A new understanding of diabetes and sexual dysfunction is that it is not only endothelium which gets affected, but they feel weak, so there's mitochondrial dysfunction also, which we see because of the overload of glucose and fatty acids which we are seeing. So, molecular dysfunction in diabetes is a new concept. Insulin resistant states are associated with mitochondrial dysfunction or decreased mitochondrial content or both. When you look at diabetes, which affects the metabolic health, if there is obesity, aging, and sedentary lifestyle, the whole mitochondria get decreased. And if you want to make it better, you need to have healthy diet, exercise, and pharmacological agents. So, exercise is, according to the scientists, a very good, which increases the metabolic health, insulin sensitivity, increase ROS, increase cellular concentration, and all that. So diabetes-induced erectile dysfunction is endothelial dysfunction and mitochondrial dysfunction, ultimately leading to emotional dysfunctions. But what we all physicians who want to treat erectile dysfunctions today need to understand is they need to have been educated on all this. It's a red signal for impending disease because it's the earliest marker of myocardial infarction. In fact, the relationship of erectile dysfunction and subclinical cardiovascular disease has been clearly mentioned. So how do we manage erectile dysfunction? We should understand men and women are two halves of humanity. The problem may be in the man or a woman, but the solution always lies in the couple. There may be menopause or endopause, but during sexual dysfunction, it's a couple pause. So couples need to be counseled together. We have two beautiful validated questionnaires which are there, IIEF 15 and SHIM. Rule out this psychogenic cause by asking a couple of questions. One of them is, do you have early morning erections when you get up from sleep? If he says yes in last 8 to 10 days, he had 2-3 times, he has got psychogenic erectile dysfunction or situational erectile dysfunction. He does not need PD5 inhibitors, he just needs counseling. We have a lot of strategies to manage blood pressure, cholesterol. We need to look at the feet and oral hygiene as a must in every patient. We also tried office sildenafil 50 mg or ICV intracavernous vasoactive injection test to rule out psychogenic. Additional tests we do are serum testosterone free, total SHBG, thyroid, FSH, prolactin, vitamin D, USG scrotum, serum PSA free, total digital rectal examination and VG scan. So how do we treat? Oral drugs, injections of papaverine in the intracavernous, vacuum therapy, intraurethral drugs. And if all these fail, we send our patients to the urologist for implants. But counseling and lifestyle measures have been the mainstay of treatment for erectile dysfunction. The 2018 revision of process of care model of management says that lifestyle changes must be accompanied as the first medical line of therapy and along with counseling. So sildenafil burden, we have got a lot of, many have already been explained, side effects have been told, contraindications. But for every diabetic, 12 weeks treatment of tadalafil, irrespective of whatever be the HbA1c or even hypertension, prostatic hypertrophy or even dyslip, showed beautiful results. My friend Dr. Jyoti, they've tried insulin pumps on these patients and showed improvement in 83% sexual functions in these diabetics. Metformin is now being a drug which improves the endothelial health beyond doubt. SGLT2 inhibitors again are a novel approach which cause loss of weight and improve all the causes which are of vasculogenic causes. So if you combine SGLT2 and metformin, you need not give them any additional burden pill of giving them PD5 inhibitors. Buried penis syndrome can be treated with 1 gram of metformin, sesame seed oil and L-arginine gel. So there are a lot of novel techniques now, low intensity shockwave therapy, plasma, platelet-rich plasma, which we are doing a great research now, 68 patients already done. So treating ED is now not a big thing, but we need to understand these drugs are not curative. So we need better tools to give them a cure, and regenerative medicine is the answer. Diabetic impotence was tried by giving blood stem cells from the umbilical cord. About 15 million umbilical cord cells were given, and they found 6 out of 7 men regained morning erection within 3 months, and these patients did not need any PD5 inhibitors. Along with phytonutraceuticals and other things, we can give L-arginine and fenugreek, which have been known to beautifully give them control of hypoglycemia and also increase in the testosterone level. What is new in medical treatment? We have avanafil, a new drug which is having a fastest onset of action, 15 minutes, and less side effects, and the half-life is 5 hours. And these drugs can be given to patients who are on nitrates. Unlike the other PD5 inhibitors, you got to stop the nitrate on the day when he wants to take avanafil and has sex, and then this drug gets washed out in 5 hours in the body, and then next day he can again start his nitrates. So the last part of my talk is, we know PD5 inhibitors are a sort of therapeutic in most of these diabetics, but we can give them empagliflozin, metformin, a new drug, imeglimin, which restores not only the endothelial function but also mitochondrial dysfunction, can improve erectile function, which is a very, very important thing we need to learn about it. Two years of treatment with testosterone also gave remission of diabetes, and these patients improved in their sexual life. Dean Ornish proved that there was coronary artery disease reversal just by intensive lifestyle changes, no drugs. So, even Cleveland Clinic proved that with nutritional intervention, the coronary artery disease can be halted and even reversed. My teacher, Dr. R.D. Lilly, showed us several strategies to improve the endothelial dysfunctions. Lifestyle modification should be your first religion, because improving lifestyle and dietary recommendations can improve oxidative stress, pro-inflammatory milieu. So my last slides, the secret of sexual fitness is try and love your body. Avoid salt, oil and sugars. Give a U-turn to your metabolic imbalance. Have a regular rhythm of sex life. Vitamin romance and vitamin touch are very, very important. And the ideal prescription for diabetic with erectile dysfunction should be counseling and lifestyle measures to be adopted as soon as possible. OHA, insulin, whatever you are taking, but make metformin and SGLT2 inhibitors as a must. Statins if he has got dyslipidemia. If he's got hypertension, give him either ARBs, nebivolol or indapamide. Low dose PD5 inhibitors if no contraindications. Low dose, short dose of testosterone if no complications, but monitor with PSA. L-arginine supplements with fenugreek, zinc, etc. Nutritional intervention, counseling and mental health checkup. So we need to give them all the nutritional importance to them for their diet and exercise, etc. We have 4 PD5 inhibitors. They do not increase the desire. 40% of them are non-responders. So we give them testosterone along with it, Sabasha. But we need to give it with caution. We can't give it to younger patients because of the fear of azoospermia, heart failure and prostate. So the Raja of all is L-arginine, fenugreek, regenerative medicine and lifestyle modifications. So friends, for erectile dysfunction in diabetes in men, we have so many things to give to them in our armamentarium that this is a symptom which can easily be managed. So it is really nice to know that ED, if diagnosed earlier, it's a blessing in disguise. Reversal of metabolic syndrome, lifestyle modification, L-arginine and fenugreek will definitely make erectile dysfunction as a correctile dysfunction. It can turn tragedy into a bliss. We must understand we are all born out of her. Feminism needs to be adored, admired, trusted and respected. If a man who doesn't adore feminism, I pray to God that he should get permanent erectile dysfunction incurable. This is my book, Sex Has No Expiry Date, available. Diabetes is the sexual health tsunami of our century. Erectile dysfunction is prevalent and the earliest marker of coronary artery disease. These PD5 inhibitors are effective treatment. Low-dose PD5 inhibitors, statins, can be an ideal choice for diabetics. Short dose of testosterone can be given with caution. L-arginine supplement with fenugreek is a boon. Diabetes remission is a fact and not a myth. Erectile dysfunction, hence, is a correctile dysfunction. Take a detailed history. Counseling, empathy, education are the key. Don't let your diabetics die in bits. And if you do so, sex really has no expiry date. Thank you all for your love.
Thank you, sir. elaborate information on the sexual dysfunction. For the past 4 lectures we had, the floor has been flooded with the sex. I mean, information on sex. Excellent, sir. Thank you so much for the talk.